most people I've spoken to, epidemiologists, believe that the exposure in India is near total, right? Now, near total may be an exaggeration, but I have a feeling that it's well in excess of 70%, 75%. Booster uptake in this country is very low. There are 700 million adults who finished 2 doses who have not taken the boosters. They're eligible for it. That is a cause for concern. Those are things we need to look at. Okay. But there is zero cause for alarm right now.
The rise in COVID-19 cases in neighboring China has set alarm bells ringing in India. Now, while no drastic measures have been announced just yet, the authorities are cautious. But amidst all this, the Aam Janta out there is a little in panic mode, spurred no doubt by the déjà vu of the deadly second wave, the deaths and the lockdowns. Now, I am joined by HT Editor-in-Chief Sukumar Ranganathan to understand whether there is a real cause for panic. Is India prepared for another wave? And what precautions, if any, must you start taking immediately? Sukumar, the BF.7 subvariant, is believed to be behind China's COVID woes, and everybody's looking at China and the visuals that are coming on our screen and panicking. This subvariant, what we understand, was in India almost 5 months ago. About 5 to 6 months ago, it has been in India. But there's been no surge. I think maybe we can start from there and then you can want to tell us, because that's what this paper believes, that there's really no need to panic just yet.
I think it's important to start from China, right? And we've discussed this in some of the previous shows that we've done. But China's situation is unique. And China's situation is unique because of 3 reasons. The first reason is that the Chinese vaccines do not work very well. They're not very effective. This is borne out by science, right? Everything I'm saying is purely based on science. It's not based on belief, or it's not based on politics or anything. It's purely based on science. Not as effective, and especially ineffective in older populations, according to a fairly large study that was carried out in Latin America and published in Nature, which is a peer-reviewed journal, right? So you have to accept that as a fact. The vaccines don't work very well. The second thing is because of the restrictive zero COVID policy that China has had, exposure is very low, which means people have not, they do not have prior exposure. It's what in India is popularly called, you do these what are called seroprevalence studies to see how many people have antibodies, right. and at various times various numbers have come out. We'll come to that in a bit. But in China, most people have not been exposed to the virus at all. And the third thing is that the population over 80, and there are a large number of older people, there is significant vaccine hesitancy. Many of them have not even taken the full 2 doses of the vaccine, leave alone the booster. Right? You put these 3 together, you get a fairly unique situation in China. So you open up, you can see what happens. It's almost as if the floodgates have opened. So that's China. Now let's look at the variant that you spoke of. It's not really a variant. It's a sublineage of the BA5 variant of Omicron. Okay. And it's been around in India for several months, as you pointed out. It's also been around in the West. And if you look at some of the Western countries, they've got a peak, but then they've gone down again. And not a huge peak, but a relative peak compared to the previous few months. And in our case, it didn't even cause a peak. So it's not as if this is one of, sure, it's highly infective and suddenly everyone's become an epidemiologist, right? I mean, you have R0 numbers that everyone's spewing forth and all that, but hasn't really happened. So I don't think we face a situation like China's. We've been writing about this for several weeks now, about what India needs to do. And over the last few days, especially to counter the panic that seems to have been created in this country, we've again been looking at data. And this morning's paper, for instance, carries a fairly reassuring work of data journalism, which looks at simply the trajectory of cases and deaths in India. it's among the lowest since 2020. March 2020, when even the first wave hadn't really taken off. So that's the level at which cases are. Two, we've disaggregated it at the level of states, because you can say that, oh, national peaks don't happen, but states may see a surge. Not seeing that even at the level of states. Deaths are at an all-time low. So I saw a fairly irresponsible piece of journalism in one large newspaper yesterday morning. I will not name it, which is good, but which looked at the number of deaths in Delhi and the number of cases in Delhi and seemed to suggest that this was a unique and sudden happening prompted exclusively by this sublineage, this new subvariant that has come out. And not the case. If you look at the last 2 weeks, the data is pretty much the same. Number of cases, 5 to 7. Number of deaths, once in a while there's one death. So, you have to really have a sense of proportion when you're looking at the data. You need to have a sense of proportion when you're responding to this, and we will come to response in a bit. I'm sure you'll want to know what we should do and everything else. So bottom line, if you look at the data, if you look at the factors such as vaccination and prior exposure, and I told you I would speak of prior exposure, most people I've spoken to, epidemiologists, believe that the exposure in India is near total, right? Now, near total may be an exaggeration, but I have a feeling that it's well in excess of 70%, 75%. So, given the level of vaccination, adults have been a significant portion of adults, I think 96%, 97% have had 2 doses. And this is adults. There are around 60 million teenagers who have not had their second dose. That is a cause for concern. Booster uptake in this country is very low. There are 700 million adults who finished 2 doses who have not taken the boosters. They're eligible for it. That is a cause for concern. Those are things we need to look at. Okay. But there is zero cause for alarm right now. I'm glad everyone's asking questions. No, I'm not glad people are panicking, because when people panic, they take the wrong decisions, including governments. When people and governments panic, they take decisions which are not based on science. So which are not based on data, which are purely based on hysteria. And I think it's very important for everyone to sit down, take a deep breath, look at the numbers, look at the underlying factors and say, great, we will be safe, but we don't need to worry.
Okay. Yeah. I'm going to talk about the fact that, and what some people have been talking about, is the low level of sequencing in India. No, that's is that a challenge?
Yeah, well, it's a challenge, but it can't be addressed, Aditi. It is a challenge, but it is very difficult to address. Why is it difficult to address? It's difficult to address because during Omicron, many people who got infected didn't get an RT-PCR test. They just did a home test. They just went. Now, how are you going to sequence those things? So it becomes difficult. So you need to have a concerted drive at the district level to collect data, but this is a nice to have thing, right? I mean, I put out a series of tweets a few days back because I started getting a lot of messages from people saying, what should we do? And the second point in that was that we should sequence, right? The first point, of course, was that we should test.
Why I asked this question was because, the second wave, when it happened, we were just, we dropped our guard and we were taken unawares as a country, as a nation.
No, but we knew the second wave was coming. If you looked at data, and this newsroom looked at data, and if you looked at what we had been saying starting early 2021, we kept saying second wave is coming. As early as February, we said the second wave was on. But you want to be irresponsible, you want to have elections at that point in time and everything else. And sure, all these things contributed. You want to have the Kumbh Mela, all those things contributed during the second wave. Why? And again, I want to make a very clear distinction. For each wave, the prescribed scientific response has been different. During the first wave, it was test. Right? During the second wave, we should have really accelerated our vaccine drive, which we did not. During the third wave, the only thing we needed to focus was on hospital capacity, and the only data we needed to track was hospitalization data, because the illnesses were not severe. This is the Omicron wave that happened between December and March in India. If we have a fourth wave, and I'm saying if, right, which is what everyone's panicking about now, I don't think you need to focus about testing, masking, isolating, social distancing. All those are nice to have, but they're not particularly scientific at this point in time. It's my personal view based on science that given our vaccination level, given our exposure level, and given the infectiousness of this variant, things like masking and social distancing are going to make very little difference at this point in time. So scientifically, what is the only thing that the health ministry should be focused on? The only thing that they should be focused on is there are 700 million people who have not taken boosters. How do we encourage these people to take boosters?
Okay.
Nothing else. You don't have to worry about anything else. What is the other thing they could look at, which is again, scientifically, the next step that they should be looking at? The world is thinking of bivalent vaccines, right? Are we developing bivalent vaccines? If we are not developing, and I'm sure Indian companies, Bharat Biotech as well as Serum Institute, are entirely capable of tweaking and developing a bivalent vaccine, but they need a push. That is again something that the health ministry should be doing, not worrying about masking. It's great to do random checks of incoming travelers because it's data. And it's important, right? You asked me this question about genome sequencing.
Right.
Within the country, suppose you feel ill tomorrow, you're not going to go and take a test.
Absolutely.
But if you're doing a random test of people who are coming into the country, it is like one little pool of data that you're getting, and you're getting it because it is mandatory to test 2% of the international travelers who are coming in. So you get a profile of the kind of, if there is a new variant that is coming into the country, you will get to know. So that is a good thing to do. But I don't think any of the other restrictions are called for at this point in time. The only thing that's really called for is
ramping up the
booster dose, and in fact that's the only thing that the health ministry should be doing.
And that's the other thing. You spoke about it briefly, but maybe you could expand some more on it, because that a very key point is also that many of us who've taken our vaccines, even the booster doses, my booster dose was almost 8 months ago, so the time has elapsed. There is, and what we had,
the science on a fourth dose is not clear.
Right.
So I'm not even going down there. I'm just, and you're right. There are some, I took it 11 months ago, right? You took it 8 months ago. Yeah. So, but I don't think the science on it. So a fourth shot of the same vaccine, great, may help, but the science is not particularly clear on it. But if you have a bivalent vaccine, and again, you need to do a lot more research and trials and everything else to see what kind of difference it's making. But in theory, if you have a bivalent vaccine, that should really be your fourth booster. If we say that, okay, great, the risk is higher, so we need to do it. But again, you need to do a proper risk assessment of what the trajectory of infections in India is likely to be like. You'll have to have a good understanding of the variants and the sublineages in circulation. And then you can take a call. Probably the most vulnerable population is something that needs a bivalent dose early next year. And others who are, people like us will probably need it a little later. But that is, if you're thinking about a fourth booster, it needs to be a new shot. It needs to be a bivalent shot. I'm not so sure that the science is
not yet clear.
The science is recommending a fourth shot of the same one.
Okay. Another critical question now, which friends coming in from friends, family, even colleagues at work, is about the children who still don't have a vaccine. If a fourth wave comes, will they be at a higher risk then?
And again, people have been very irresponsible. I can think of many famous doctors, including one in Delhi and one in Bangalore, who said, when the second wave comes, it will target children. It came, it went, it did not, right? And these guys are just spreading panic. I think they should be silenced. People like you should not be interviewing them, right? You should be very careful about who you interview, especially doctors, because there's no point in getting a doctor who's a cardiac specialist and asking him to speak on this. The research on this is current, and I have no idea how much these people are reading of the new papers that are coming out in NEGM and Lancet and Nature. And there's research that's coming out on the virus every day. Are these people even keeping abreast of what is coming. So what does the research say? So far, children not at risk, right? Even minus vaccination. So I'm not so sure that that is something that people should panic about. A couple of people did ask me about it again after this thing came out. Say we have this huge population of unvaccinated young children. Is that going to be a crisis?
That is a worry.
Yeah.
My mom called me and asked for my
nephews. I just don't think that that is cause for concern. And right from the beginning, there is a significant school of, and these are, hindsight has shown them to be really smart scientists who've been saying, don't worry about the kids, don't shut schools, but worry about the other things. And this is wave one.
Yes.
Right? So there were two really smart sets of scientists. One group was saying this, and the other group was saying it spreads by air, which is something that WHO didn't acknowledge for the longest time.
Yeah.
Right? And everyone was, we became a culture of washers and wipers, right? I mean, we would wipe everything that would come into the house and wash our hands every time we did something. But that's not the case. So I am not convinced that there is adequate scientific evidence to show that children have ever been hugely at risk from this infection.
All right. Thank you so much, Sukumar. And thank you, viewers, for watching this broadcast. So if and that's a big if a fourth wave comes, the biggest thing is to get your booster shots if you haven't got it yet. And of course, for the teenagers out there who haven't taken their second shot, to take that shot. And of course, the usual things of masking and sort of staying safe and social distancing, all good to have, but those two are critical. Thank you so much for watching this broadcast. Stay tuned to Hindustan Times for more details.